Thank you all very much for joining us. So I am Sally, and I am here to talk about support at home and what the changes mean for you, our lovely support workers. I've probably met some of you now. So I head up a team that run the event and webinar program. So I've been lucky enough probably to meet some of you at our expos and events that we've held recently. I'm also joined by Rachel. So Rachel is a product manager, and she has led a squad that has built this whole new functionality to be able to log your support hours. So very excited to have Rachel here with us as well, who can really, as the expert, she'll be able to take you through it all in lots of detail. Oh, Christy, lovely to see you. Met you on the Gold Coast. Fabulous. And at the end, actually, we have some details of our upcoming events. So hopefully we'll see some more of you towards the end of the year. So before I get started, I would just like to acknowledge the traditional custodians of country throughout Australia and recognise their continuing connection to lands, waters and culture. We pay our respects to their elders past, present and emerging, and we extend that respect to Aboriginal and Torres Strait Islander people here today. So what are we going to talk about? Hopefully all up, this will take us about 40 minutes. So do get yourself a drink, get comfortable, depending on how many questions we get. So what we'll be covering, what is support at home, why this now means that there's a new way that you have to submit your support hours, how to add your support hours later, what to do if a client rejects the service. We'll have some information on competency training. We'll have some frequently asked questions, and then there will be some time for Q&A at the end. What is support at home? Hopefully it's not a completely new concept. So we have had a session on it at our Independent Support Worker Summit in May. We've covered it in some newsletters. So hopefully most of you are aware that it's coming, but don't worry if you've missed it, that's totally fine. We will be going into it. We will be explaining all the stuff that you need to know. Yeah, let's get into it. So support at home was devised in response to the Royal Commission into Aged Care Quality and Safety. It's a new government programme. It's affecting the whole industry. So it's not a Mable thing, it's an industry-wide thing, and it's launching on the 1st of November, so this Saturday. So it's almost here. We don't have much time until it's happening, but it's basically, it's rolling in a few different types of funding to make it more of a simple system for people to age at home for longer. So the home care package program you may have been aware of, it's replacing that. It's also replacing the short-term restorative care program, and next year the Commonwealth Home Support Program will also roll into it as well. So combining a few funding programs, and it's all about creating a flexible, personalised and supportive system for in-home aged care so older people can live independently at home for longer, which, as we all are in this line of work, we all agree is a great thing to have this. So what's changing for clients? So there's actually quite a lot of changes. We'll talk you through these in more details. So under the home care package program, there were 4 funding levels. This has now extended up to 8. Budgets used to be assigned annually. They're now going to be given out quarterly. Probably the biggest change is that some people will now have to contribute to some of the services that they receive. It's means tested and it depends on someone's pension status, but this is a really big change to the system. Care management fees, so these are the fees that a support at home provider charges. They have been capped now, so they can only charge up to 10%, and service types have changed as well. So these are now the 8 funding levels. So there used to only be 4. It used to be up to 61,440 of annual government funds. So now it has increased up to 77,709. So a good thing that there is now more funding available if people need it. It's very much dependent on someone's needs. So someone will be assessed, and once they're assessed, the more support that they need, the higher level that they will be given. So once somebody has been approved for the support at home program, they receive a notice of decision letter and a support plan, which they share with their support at home provider. Just a bit of terminology reminder. So Mable is not a support at home provider. So we do not oversee a participant's budget and we don't assign services. We're slightly different. So we are a digital platform provider. And as you all know, people use our platform to connect with support workers to help them fulfill services. Home care package care recipients will move automatically onto the support at home program, and they're automatically approved for services under the program. There's also a no worse off principle. So somebody who received their package already will not lose more funding. They'll definitely be able to access all the same services they used to access before. And just a quick answer to Glenda, yes, we will definitely be sharing the slides afterwards and sharing the recording. So don't worry, you don't need to furiously scribble everything. So as we said, budgets are going to be all allocated quarterly now instead of annually. So participants will be able to save up to $1,000 or 10% of their package, whichever is more at the end of each quarter. They'll be able to retain any unspent funds. And there's this concept that's been introduced, which is called grandfathering. So people who received their home care package before the 12th of September 2024, they're what's called grandfathered. So they do not need to co-contribute to services. So here you can see the different service levels that we now have. So on the left, we have the contribution categories. The first one that you can see is clinical support. So that covers things like allied health and therapeutic services and nursing care. And because these are really essential to someone's life, there's no contribution that people need to give to this. But some of the other services, so if you look at independence, so that covers things like personal care, social support and community engagement and transport, then the contribution level is between 5 and 50%. So a full pensioner will contribute 5% to the cost of independent services, where someone who is self-funded without a Commonwealth Seniors Health Card, they have to contribute up to 50%. And then the final category is everyday living, and that kind of covers more things around maintaining independence at home. So domestic independence, home maintenance and repairs, and meals. So that contribution category, it's a minimum 17.5% and then up to 80%. So as you can see, now that we've explained, now that there are these different contribution categories, it's actually going to have a flow-on effect to how how they're calculated. So how a support at home provider will calculate those fees for their clients. So because of this, we have had to update our invoices. So just given like a really small snapshot of a Mable invoice and what it looks like. And so now it has been split into contribution categories. It details the number of hours that have been provided for that service and the rate of those services. And then that now means that a support at home provider will be able to calculate their clients' co-contributions. So that's not actually something that Mable calculates or Mable charges. It is on the support at home provider to organise that with the client directly. So what does it mean for you? All of these changes for clients does have a knock-on effect, and it also means now there are some changes in the way that you need to log your support hours. So to really help you, we have developed a new feature. So this means that you're now compliant. If when you use it, you will be compliant when you submit your support hours. So this is a mandatory change. So if you work with clients who receive aged care government funding, now you do actually have to use this. If you have clients who receive NDIS funding or they pay privately, you will be able to use this system if you want. It's not a mandatory requirement, but it's actually some really good use cases. So for instance, if you provide overnight support and you want to have a different rate overnight compared to in the morning, you can actually now use this system. And so it makes it easier for you to charge those different rates. And it can also be useful around plan review times, etc. If an NDIS client can really have that detailed view of all of the services that were provided in those sessions. So our recommendation here, just have a chat with your client, see what they want to do, see what you both want to do, and just make sure that you align on that before you move forward. And I'm just going to give you a little tip here because it's a big crossover period for the whole industry. We do highly recommend that you log your support hours this week. So any hours that you have done in October, log them on Friday, just so it's all nicely tied off. Anything from the old home care package system is logged on Friday, and then moving forward, any further hours, any hours that you do in November can be logged separately. And this is just a quick, it looks a bit complicated this slide, but I will explain it all, so hopefully it makes sense to you. So you can see on the left that in the first example, someone has assigned all of their hours to meal preparation. So that's 1.5 hours. That's under the everyday living contribution category. And so a client will now need to contribute between 17.5 to 80%. So that means that the client charge could be between $18 and $84 if you just logged all your hours to meal preparation. Under the orange example, you can see that the support session has been split into 3 services: meal preparation, housework, showering, dressing, and grooming. And you can see that 1 hour now goes against the everyday living contribution category, which has a 17.5 to 80% contribution level, but then half an hour has gone against the independence contribution category, which has a 5 to 50% contribution level. So that actually means that when you work it all out, a client would have to pay between $14 to $74. So you can really see that the difference, like if you did put everything in that first service, the client is actually being overcharged for that service, compared to the second example, where when it's accurately done, it means that they are having to pay less. And if that was happening daily in a week, the client could be overcharged up to $70 a week, which isn't great. Nobody wants to overcharge someone, have to pay extra. So there we go. Now I'm going to hand over to Rachel, who's going to talk you through the new way to submit your support hours.
Thanks so much, Sally. So my name's Rachel, as mentioned. I'm one of the product managers here at Mable. And today I'm going to be talking through some of the platform changes we've made to align with the new requirements under Support at Home. So the biggest change is that you can now submit your hours with multiple services, and you can do that through both the desktop or the mobile app. And this is required so that if you are providing more than one type of service during a session that have different contribution categories, your client will be charged the correct contribution fees. So the first change I'm going to talk through is the step-by-step process for using check-in and check-out in the new Manage Clients mobile app. And after that, I will show you how to submit support hours from a planned session, and also if you haven't planned the session in advance. So we will start with check-in, check-out, but I also will go through the other methods you have available right now to submit your support hours. So today, I'm going to be using an example of a support worker who has a client with aged care funding called Madeline Smith. And you can see here that I have a planned session for 2 to 4 p.m. today for Madeline. And so I'm first going to check into the session, and then I can start adding my services and support notes. If you'd like, you can also wait to add your services and rates until after you've checked out, if you prefer to do this after your session, and that way you can submit all your hours after you have finished providing support. But for now, to enter my services and select my rates, I'm going to select Confirm Services and Rates. I can now add the first type of support I provided to Madeline today. So I'm going to select Choose Service and then select the service I provided. So today I started my session with Madeline by taking her out to a cafe for coffee. So I'm going to select Social Support as my first service. And the list of services you can see here are the services that are in my agreement with Madeline. If you only have one service in your agreement with a client, you'll only see one service in this list. And if you're providing services for an NDIS plan managed client, the list of services you see here will be the NDIS service categories you have in your agreement with your client. So the time for your first service will default to either the planned session time, or if you are already checked out, the check-in and the checkout times. You can adjust the start and end times of your service by selecting the date and the time fields you can see here. And you can also quickly adjust the end time of the session by clicking on the minus and plus 15-minute increment buttons to shorten or extend the end time. So today, in our example, I arrived at my client's house at 2:10 p.m. and we drove to the cafe and then came back at 3 p.m. to the house. So those are the times I've entered for social support. Your rate will also default to the relevant rate in your agreement based on the service and the time entered, but you can still select from other rates in your agreement if you need to change this. So you can see here, I have a weekday daytime rate for social support. So that's what has been automatically selected. And I can also select from my other rates for social support in case, for example, today was a public holiday and I need to change it to that rate. Do make sure you select the correct rate for the service and time you're providing, as selecting the wrong rate may result in rejected hours. I happen to have a travel rate in my agreement for Madeline, so I can also see the option to charge for kilometres travelled by providing this service. Today, I drove Madeline to a cafe and then back to her home, and it was a 10-kilometre round trip. So that's what I've entered under the social support service. If you only travel during one service in the session, you just need to add it to that one service. But if travel occurred multiple times in a session, then you can add it to each service during which it occurred. If the service you're providing is transport and you have this service included in your agreement, you can add this as the service rather than or as well as entering and charging for kilometres, whatever you have agreed to with your client. And once you've entered kilometres, the travel subtotal will be added to the service total. And you can see this has now been added to the session summary at the bottom of the service page, which is the last screenshot you can see there. If you did provide more than one type of support in a session, you can now select Add another service provided to add the next service. In my session today with Madeline, after we got back from the cafe, I had a 30-minute lunch break and then I vacuumed and changed the linen. As I've decided not to charge Madeline for my lunchtime, I've adjusted the start time of my second service, which would be domestic assistance, to be 30 minutes after my end time for social support. And I've created an unpaid break by doing that between the services. As a reminder, if you are only providing one type of service during the session, you only need to add one service. Now that I have entered in all of my services and session times, I can record my health notes, enter my support notes, and select whether I need to report an incident as usual. And once complete, I can submit my support hours by selecting Checkout and Submit. As mentioned, you can also split your session into multiple services if you are submitting support hours from a planned session or if you haven't planned the session in advance. If I didn't have a planned session with Madeline, I could add my support hours by selecting Add New Support Hours from the Sessions tab. And if I didn't check in at the start of my session, but did have a planned session, I could add support hours for the relevant planned session at any point in the same page. I can then follow the same steps we just went through to add one or multiple services and submit my support hours. We've also made some changes to the look and feel of the sessions page and the support hours pages. Your submitted support hours will still appear in both the Sessions tab and the Support Hours pages. And you can access the Support Hours page on the app via the More tab you can see. To make it easier to track, You can now see the approval and the payment statuses of your sessions in both of these pages. You can see here that I have a past session for Madeline that has 3 services. One service has been approved by Madeline and is awaiting invoicing. Another has been invoiced and is waiting for Madeline's funding provider to make payment. And the last one has been paid to me already. It would be really rare that you'd have a session with 3 services in 3 different states. So most of the time, you will just see one status for each session. In this example, as I wanted to see a bit more information about this session with my client, I tapped on the session card to open the support hours details page. That's your last screenshot you can see in this page. And here you can see all the details I entered. And I can also make changes to my session here using the edit or the delete buttons. Now that we've gone through the new process for submitting hours, I'm going to show you how to deal with rejected services. You can also follow a similar process if you need to edit your support hours before they have been invoiced. If a client rejects support hours, they might reject just one service or the whole thing. They don't currently need to provide a reason for rejecting support hours, but when they select to reject a service, they are prompted to contact you to provide more information. When a service is rejected, you can make changes to the rejected services and session immediately. In this example, my client Madeline has rejected one of the services and approved the other one from the session I submitted today. When she rejected this, I received a notification prompting me to review the session. She also sent me a message to let me know that the reason she rejected the service was because I made a mistake entering the times. And I can review these support hours in both the support hours tab and the sessions tab. As I need to resubmit the rejected service with the corrected time, I'm going to select Resubmit to review my support hours and to make the required adjustments. Once I've done that, I can change the service times or kilometres as needed and make any required changes to the support notes, the health notes, or the incident. Here, I'm going to update the time for social support, which was the service that my client Madeline rejected, and I can then see the edited support hours. Once I've made the necessary changes, I'm going to submit. And this will send a notification to my client asking her to review and then approve the amended service. So I can now see a resubmitted badge next to the rejected service, and the resubmitted service appears with a status of approval pending. Once my client approves these changes, the status of the resubmitted service will change to invoice pending. Thanks all. So we will have some time for questions at the end. I can see there's lots coming through in the chat. So for now, I'm going to hand back to Sally, who will take you through the new training requirements. Thanks all.
Oh, the old unmute. Apologies. Hey everyone. Okay, competency training. So I guess this sounds a bit full on, but don't worry, it's not going to be too much to handle. So I'll just talk you through what this actually means. So in 2024, the new Aged Care Act mandated that all support workers must undertake competency-based training if they are going to support an older person who receives government aged care funding. There's 5 modules that it needs to cover. So person-centered, rights-based care, culturally safe, trauma-aware and healing-informed care, caring for individuals living with dementia, responding to medical emergencies, requirements of the Code of Conduct, serious incident reporting scheme, and quality standards. And how are we going to do that? Well, it's going to be free. It's going to be delivered via the Mable Learning Hub. Hopefully you've all discovered the Learning Hub. We have 170 courses in there, so it is a great way to upskill. If you go into the benefits section of your dashboard, you can see a link to the Learning Hub. You just need to create an account and then you can access all those courses. So for these specific competency training courses, they don't need to be taken yet. We will send you an email in the new year. So we're just giving you a heads up that it's coming, just so that you can be out looking for these courses when they come. So once you have done them, there's those five different courses. It will take about 2 hours, but you don't have to do them all at the same time. You can do it over a period of time. So once you have done them all, you will receive a certificate, which you just need to send into our support team so that they can have a look at it and then they can add a badge to your profile. And from June 2026, if this training is not completed, you will not be able to apply for jobs with clients receiving aged care government funding. Frequently asked questions. I'm sure there's a few. Hopefully we will cover off a lot of your questions here, and then we will go through some more if we haven't. So let's get into it. We realise this is there's a bit to get your head around, so we imagine this will be a problem. I can't remember what services I provided and for how long, what should I do? So this is going to happen. It's a new system. It takes a bit of time to learn it. But what we do say is it's really important to record the services you provided in a session as accurately as possible. Obviously, you through that example, you could see that if you get it wrong, then your client ends up having to pay more. So it's really important to really try and get it right. If you can't remember, have a chat with your client. Just see if between the two of you, you can remember and you can fill out the support hours to the best of your ability. Just some tips to make sure that you get it right in the future. So submit your hours right after a session so the information is fresh in your mind. You could note down what services you provided and when. You could do it on your phone or in a notebook, for example. But we do have a really cool new feature in the app that actually just lets you do it as you go. So you could check in at the start of the session and then you could add the services as you go so that you can just remember as you're working. What happens if I provide a service that is not in the agreement? Don't do it, please. It's a really bad idea, because if it's not in your agreement, it actually just means that you're not covered by our support worker insurance, which is very comprehensive insurance that covers you for a lot of things that could happen, and you just don't take that risk. It's not worth it. So if you don't have the service in an agreement, then you do need to go back and amend the agreement. So change the agreement, and then your client will need to accept that agreement before it would show up in your to log your hours. Why has my service been rejected? So we do expect that this may happen, especially in the beginning. We've done some training for clients as well. So we're holding webinars for clients this week as well, just so we can train them on the new system as well. Hopefully once people really start to get their head around it, that we won't see many rejections, but a couple of reasons that we do see why services get rejected: if the times or dates are wrong, if the services that have been selected were incorrect, and potentially as well, you may have by accident selected the wrong rate. So when you do see that a service has been rejected, just go back, look at those, make sure that all of those things are correct, and then reach out to your client or their representative and just have a discussion around why they rejected it, and then you can just go back and fix it. When something has been rejected, so what we do is we say there's 3 services there, 2 of them have been approved and 1 of them hasn't been approved. The 2 that have been approved, we move forward with the payment for those services, but it just means that final session that hasn't been approved, it will take longer to get the payment for that, because it has to go through that reapproval process. Once it's been approved, then we then invoice the client and get that money for you. How does this affect the different payment methods? Well, there's not really any change. Express Pay is still the same, works the same way. Just in the new app, there is a slightly different way to request it, which I'll show you in a minute. For 10-day payments, again, there's no change to how 10-day payments work. It's just in the platform, we're not displaying why the 10-day payment was declined on the platform. We've changed that to just send you an email so you have that information to hand. And just to show you how you request Express Pay now. So if you're in the app, if you go onto the support hours page, you can then under the invoices and Express Pay tab, you can just click that link there, request Express Pay, and that works in the usual way. And same on desktop, you can just go in the billing page and then go to My Invoices. Should I charge my client for the time it takes to submit my support hours? So ideally, you should submit your support hours and session notes really quickly after finishing a session. It's okay to charge your client for the time that it takes because it's only a few minutes that it takes to fill them out. If you're not sure, just have a quick chat with your client as well, just to make sure, again, you're on the same page. What do the payment statuses mean? So there's a few here now. I'll just talk you through what they all mean. So approval pending, that means that you have logged your hours and then the client has up to 24 hours to approve those support hours. If they haven't been approved after 24 hours, then they are automatically approved. Rejected, it means one or more of your services has been rejected by the client, and it's quite clear when you look, you can see that chip there that details which service it was. Invoice pending, that means that the support hours have been approved. Collection pending means that the invoice has been sent to the client or their provider and we're waiting to receive the payments. Payment pending means we have received the payment and we will transfer it into your bank account. That takes 2 business days, so that means that the payment is almost there. Partially paid means that partial payment has gone to your bank. It may be because of issues with the client or their funding organization. Happy days, the best one, paid, that it's gone into your bank account. And voided, it means your client or their provider has raised a dispute, and then we will contact you to discuss next steps. So realize this is quite a lot to take in. We have some help center article. We have a help center article that outlines all of these steps just to make it more simple for you. And we are looking at the support hours page as well. So seeing if there's some changes that we need to make there, because I've seen a few comments as well. We are aware that's a work in progress as well. Will these changes cause payment delays? We really do hope not, but as I said before, this is a government mandated change that is happening to the whole industry. So it's not something that Mable are doing, it's an industry-wide change. And so we do anticipate that some support at home providers may have some issues with their payment systems. So we've really have worked to minimize this. So with, for instance, our new invoice format, we've shared that with all of our provider partners. We've made sure that it's suitable for their all of their systems. So we've really worked in collaboration with all of the partners that we work with. We do have 7-day payment terms. There are standard terms, but despite that, there may be some delays on their end while they get all of their systems ready for this. Our payments team are ready. They're going to be working really proactively if they do come across any delays. Like, we have good relationships with all these providers, so they will be working very proactively to try and fix anything that as it crops up. Here's some tips, the things that you can do just to make sure that none of your invoices will get caught up, just in case. So have a discussion with your client or their representative and just make sure that they have funding for all of the services that you currently have in your agreement with them. Make sure that you log your support hours correctly using the support hours tool. Log your support hours immediately after each session. Like, don't wait, just get them in so that you can start that payment process straight away. And a good all-around tip is just make sure that your support notes are really professional. They detail what happened accurately in the support session, so there's no back and forth or there's no questions around what happened in the support session. What should you do if your payment is delayed? So if your invoice is overdue, start by checking with the client to make sure that they did have budget to cover those services. Hopefully you did that check as we advised beforehand. If there wasn't sufficient budget, you will need to amend the agreement and email us so that we can void the invoice and you can submit it again with different services or correct services. If the services were within budget and there's no funding issues, you can contact us once the invoice is more than 21 days overdue. We are unable to do anything about the collection process until it's 21 days overdue, but we do have a team, our payments team, who follow up with funding organisations on all overdue invoices every week. And so we do keep going, trying to get that money for you as quickly as we can. And as ever, we're here to try and help and support you. Here's a few ways that you can contact us. Note our phone number. So 1300 736573. It's available Monday to Friday, 9 a.m. to 6 p.m. Sydney time. We also have live chat. So I think most of you have used live chat many times, but it is the quickest way to get through to us. It's available on the Mable website. You just need to click on the icon. It is staffed by real team members. It's not AI, it's actual genuine people. So it is a quick way to get, especially with payment queries, it is a quick way to get a question. That's available Monday to Friday, 9 a.m. to 6 p.m. Sydney time again. And then we do have lots of great advice on our help centre as well. So mable.com.au/help_centre. We've sent you all of the videos that we've made for this new way to log your support hours. But if you haven't, you've misplaced that, you can find them again in our help centre. You can find information about payment statuses and all of the other things that we've covered today. We're here to help you. We recognise that it's a bit tricky, so that's why we're doing everything we can to make sure that you feel supported and you know that we're here to help.